Welcome back to Medicine Made Easy with me, Kavitendral. Now we will be discussing some important topic in pediatrics, which I have integrated with some points in embryology and gross anatomy, as well with obstetrics. So you will like this video for sure. Before we actually proceed with the topic, if you have not subscribed our channel, do subscribe for more interesting videos like this, and as well press the bell icon so that you will receive regular video updates. Before we actually go into the discussion per se, we have to know two important points which makes us remember the entire topic very more easily. So take in only 2 points, that is human heart has 4 chambers and hilum of kidney is at L1 level in adults. Just remember these 2 points, we will start our discussion, right? So from that taking points, we know that we are going to discuss about the heart and as well the kidney. So we'll start with the fetus. Basically, a fetal cardiac output to a kidney is 2 to 4 percentage. That is renal blood flow. One. See, when the heart is going to form, heart is one vital organ. So it is forming as early as 4 weeks of intrauterine life. That is why I should remember heart has 4 chambers. So 4 weeks it is forming. It is just to remember only, okay? So 4 weeks heart is formed. But the heart is formed ultimately from endocardial tubes. These endocardial tubes are formed at day 22, around 21 to 22 days. Heart is formed, but it has to work, right? So it is seen as a cardiac activity. This cardiac activity is starting at 5 weeks, but it is starting at 5 weeks. But how do we know either at 4 weeks heart is formed and working, or 5 weeks heart is formed and working? We're going to find it through ultrasound, because you're all speaking with fetus. You're going to find it through ultrasound, and we are going to find it as early as 5 weeks. Then what scan it is? Dating scan. Yes, as early as 5 weeks you're finding the cardiac activity. It means what? Through transvaginal ultrasound. Okay, so by transvaginal ultrasound we can find the cardiac activity by 5 weeks. By 6 weeks you can find it through transabdominal ultrasound. So TVS here stands for transvaginal sonography, right? Okay, so 5 weeks la we are seeing cardiac activity. This is at the dating scan, basically, where we are going to find the viability of fetus by seeing the cardiac activity. You're going to find the intrauterine pregnancy or extrauterine pregnancy. As well, you're going to do the dating for this gestation. So done. So 5 weeks la cardiac activity started. Cardiac activity na enna? That there is this heart is going to pump. When heart is going to pump, there will be obviously renal blood flow, which is given na 2 to 4%. It means what? Renal blood flow is whenever there is renal blood flow which is happening, there is a glomerular filtrate rate is formed. Yeah. So 5 week cardiac activity is seen, and for sure 5 to 9 weeks itself this GFR is going to begin. If GFR is going to begin by 5 to 9 weeks, kidney, the place of this activity would have been produced, I mean the kidney would have been formed by this time of 5 weeks itself. Yes, it means what? Kidney is formed before 5 weeks, but we know kidney, like kid, no kid is kid are small children, they will grow. Likewise, a kidney which is formed in the iliac fossa lower down, it will ascend to T12 to L3 level. Like how kid is growing up, like this kidney is going up. Okay, so it is ascending up to T12 to L3 level, and that is adult kidney. What I have said, by 5 weeks itself it is started, and by adult kidney location, that is by at T12 to L3, this kidney is going to ascend up from 6 to 9 weeks, right? Okay, now it has ascended up. Now all the process going on. Where is the hilum of kidney? We know the adult, now it is reached to adult kidney location, and the hilum is at L1 level. Remember, L1 level, there are many other events happening at L1 level, and L1 level is called as a transpyloric plane. We will discuss this plane shortly. Okay, now what we have seen at 4 weeks heart form, 5 weeks this cardiac activity is seen, this through TVS, and by the same 5 weeks GFR form. It means 5 weeks kidney would have also been formed. It has ascended up to the adult location by 6 to 9 weeks, and now coming then. What we have known is by 5 weeks GFR is formed. It means filtrate is formed. The next process, urine formation. Yeah, so urine is now formed. Urine is formed, but where it is stored? In urinary bladder. Yes, it means urinary bladder would have been formed by 10 to 14 weeks. That means by 12 weeks we are seeing the kidney. The time we are seeing kidney itself, the bladder would have been formed. Right. So by 10 to 14 weeks itself, this kidney is formed. I mean, the tubular function is also started, right? So, but what happens now? Fetus has urine in the bladder. Now, what this urine in the bladder is going to do? It is going to void, but where? In amniotic sac, right? Yes. So, see, ultimately, this urinary bladder is going to form by 14 weeks, and the tubular function is going to start to mature at 14 weeks. If this is what's happening, urine is directly says that urine is filling in this bladder. It means what? The urine which is present in the bladder is going to evaporate out. That is into the amniotic sac that contributes to amniotic fluid. Yes, so fetal contribution of amniotic fluid is present. And when does amniotic fluid level is principally depending on fetal urine, that is at 16th weeks. So remember, by end of 14 weeks, bladder is formed plus 2. That is 16 weeks. So above 16 weeks, fetus is the principal source of urine. Fetal urine is the principal source for amniotic fluid, and that amniotic fluid is in the amniotic sac. But remember, by more than 38 weeks of gestation, the amniotic fluid volume is going to decrease. It means what? At 38 weeks of gestation, the amniotic fluid level will be around 1 liter. After 38 weeks, it decreases. That means at term, nearly around 600 to 800 ml of amniotic fluid will be present. So 600 to 800 ml of amniotic fluid. This amniotic fluid is also called as liquor amniae or liquor, right? So that's what it is. Then at the term, urinary bladder has nearly 50 ml of urine capacity. This is we are speaking to urinary bladder of fetus. At term, it has 50 ml, and at term, the amniotic fluid in the mother is 600 to 800 ml. We are speaking related to normal pregnancy. Now coming to the urine passage. So by this 50 ml of urine has to pass. Yeah, so like that. After birth, this baby is going to pass the urine. That is, the neonate is going to pass the urine in first 48 hours. And this is usually, but not all babies will pass in first 48 hours. Only a minority of a percentage is going to pass sometime out of this first 48 hours. The urine which is passed, which is basically of pH, is very high. This pH is high for degree of acidemia. But why? Because it says by day 1 to day 14, that means by first 2 weeks, the maturation of GFR and tubular function is going to slowly progress. This is going to completely mature by 2 years. Do you remember this 2 years? This is the crucial period where the first 1,000 days of a fetus is very, that is, the baby is very important, especially for neurological development. Not also for that, that is also for renal functions. For the both GFR and tubular function is well matured by 2 years. So with this, we are completing this video. In next video, part 2, we will see how to easily remember the events at L1. Till then, stay tuned. Bye bye.